Okay, okay, fine, beta. So I hope that there was some issue of the voice. I hope now audio video is fine. Okay. Now please let me know, beta, whether audio video is fine. Okay. So once again, a very good evening to all of you guys. Yes, Sandeep, Kajal, Bhagwan, Balram, yes, beta, everyone, a very good evening to all of you guys. I hope that you are preparing for your exam with full of dedication and hard work is going on, as the last week is going on for before your exam. So I hope that you are preparing very hardly, beta. So this time we are going to discuss the 25 most important physiology questions, that the topics which are most high yield for this upcoming FMG exam. So beta, in this session beta, I actually just try to make all of those topics questions which are very high yield for this upcoming FMG exam. So वैसे तो आपको पूरा पढ़ना है, and already you have been studied all the physiologies before that, I know that, but this session is basically meant for the high yield part and the thing that how you should apply all of this knowledge in when you are solving the MCQs. Okay, guys? So, okay. So, without wasting so much of time, let's start with this 25 most important physiology questions, right? Okay, beta. So, here is the first question on your screen and start answering for this question. So, which of the following is best describes the nerve refractive period as shown in the graph? This is the question. Graph, I am going to zoom it little bit. So, this is the graph over here. And the options are, the first option is the period during which a second action potential can be elicited with a stronger stimulus. The period during which no action potential can be elicited regardless of the stimulus strength. Option number C is the period immediately following the peak of an action potential, and option number D, the period of hyperpolarization immediately following an action potential. Yes, beta. So, 1 second. Let me adjust my photo so that you can see full of the options of this question. Yes. So please answer. Yes. Everybody, yes. This is B, B, C. Yes. But what is the question is asking? The question is asking that which of the following is best describe the nerve refractive period? As in this graph, you can see, clearly you can see that this is the nerve action potential graph, as you can see over here on your screen. So over here, this minus 70 is the resting membrane potential of the nerve fiber. This minus 55 is the threshold value. So initially, this resting membrane potential will reach up to the threshold value. And once it will reach up to the threshold value, what could be happen? This nerve is going to be excite very suddenly, and which ion is going to inside of the cell? Which ion will move inside? Please tell me in the phase 1, which ion is going to move inside? Yes, guys. Please answer me. Which ion will move into this phase? Yes. Yes. So into this phase, the which ion going to be enter? Yes, guys. Very good. Very good. So this is the sodium influx. Yes, beta. You remember very well. Sodium influx, right? After that, this will reach up to the greater positivity side, and once it will reach up to the positive side, the action potential is generated. So this area or this peak is denoting the action potential of the nerve fiber. And now the action potential means electricity is created. Bijli ban gayi hai. Now what will be happen? Now this phase we also called as which phase beta? This is the depolarization phase. This is the depolarization phase. This is the action potential peak. And now what will be happen into the phase 2? The phase 2, the potassium start moving out. So potassium efflux or outflux will be happen. So and this stage, the potassium outflux will be happen. And this phase is called as repolarization phase. Repolarization phase. Okay. Okay, fine, beta. I'll go a little bit slower. So if you want, yes, no problem. We can slow down the speed as well. So look at one more time. I told you that initially the resting membrane potential of the nerve fiber was minus 70. What is the threshold value? Threshold value is minus 55. Once the threshold value is reached, the nerve is going to depolarize very fastly or quickly, and sodium ion will move inside. So this is called as sodium influx. This sodium, it is a positive ion moving inside of the cell. So what could be happen, guys? This leads to the positivity inside of the cell, and now this positivity will make the electricity or so called as action potential inside of the cell. Now, after that, this cell again want to go into the resting condition. So, what this cell will do? This cell will start moving out or losing the positive ion which is present inside of the cell. Those are the potassium ion. So, potassium start moving out from this area. So, this is called as potassium efflux. This is called as potassium efflux. And now what will be happen? Again, the positive ion, if start moving outside from this from inside of the cell to the outside, what could be happen? Again, this cell will come side to the negative side. So this is called as nerve action potential graph. Now, talking about the refractive period, right, brother? Talking about the refractive period. Refractive period, remember the refractive period. Question is asking about the refractive period. So refractive period means the period when the one stimulus is already going on into the cell or the nerve fiber. The second stimulus, if you will give to this cell, it won't show any response. So this was the definition of the refractive period, which we have been discussed in the class many times, right, beta? So refractive period was two types. एब्सोल्यूट रिफ्रैक्टिव पीरियड एंड रिलेटिव रिफ्रैक्टिव पीरियड. रिमेंबर मैंने बताया था बेटा कि जब ऑलरेडी आप एक काम कर रहे हैं तो क्या आप दूसरा काम करना चाहते थे क्या? नहीं. सो दैट इज व्हाई दिस पीरियड वाज कॉल्ड एज रिफ्रैक्टिव पीरियड. ऑलरेडी दिस नर्व इज डूइंग द one action potential. So in this time, if you will give the second stimulus to this nerve won't show any response. This is called as refractive period of the nerve fiber. But now, when we divided this refractive period into two phases, absolute and relative. Absolute and relative refractive period. Absolute means no response at all, and relative means some response if you will increase the strength or the current. तो पहले आपने थोड़ा सा कम करंट दिया था, अब अगर आप करंट को थोड़ा सा बढ़ा दें, if you will increase the strength of the stimulus, what could be happen? In this time, this nerve fiber will start showing another action potential. So now you know that according to this graph, I told you from this area up to this area, this phase was completely for what beta? For absolute refractive period. So from this area up to this area, this is the area for absolute refractive period. And from this area up to this area, this is for relative refractive period. So if यदि मैं यहाँ पे if I will put the A, B, C, D and E. So can you see from this D to E, it is the relative refractive period, and from A to D, this is absolute refractive period phase. This is the absolute refractive period, right, beta? So now you can easily answer. So देखो absolute refractive period, this is consisting the full phase of the depolarization and 1/3 phase of the repolarization. So again, if another term on in another language, you can say the absolute refractive period is consisting the full phase of the depolarization and the 1/3 phase of the repolarization. So I hope now it is clear in everyone minds, right, beta? Okay. Yes, D to E is relative. Yes, yes, Sachin, very good. Yes, beta. Okay. Okay, very good. So this A to D is absolute refractive period, from D to E is relative refractive period. And what is the question is asking? Which of the following is best describe the nerve refractive period as shown in the graph? So beta, this is just only asking the definition of the refractive period, right beta? So now what is the refractive period? Now let's talk about one by one all the options. Option number 1. The period during which a second action potential can be elicited with a stronger stimulus. Okay. The period during which no action potential can be elicited regardless of the stimulus strength. Option number C, the period immediately following the peak of an action potential. No, beta, it is absolutely wrong. This statement absolutely wrong. Option number D, the period of hyperpolarization immediately. But a hyperpolarization phase, this is the hyperpolarization phase, right? This is the hyperpolarization phase. So the period of hyperpolarization immediately following an action potential, no beta. This is again a wrong statement. So now please tell me from this above two options, number 1, option number A and the B. A is stating the period during which a second action potential can be elicited with a stronger stimulus. No, beta, because this is talking about with both absolute and relative. The option number B, the period during which no action potential can be elicited regardless of the stimulus of strength. Yes. So now the best answer of this question is this option number B, the period, because question is asking about the refractive period. Question is asking about the refractive period. And what is the refractive period? The period during which no action potential can be elicited regardless of the stimulus of strength. Right, beta? So very good, beta. Very good. So this is option number B is the right answer of question number 1. Yes, beta. So those who answered correctly, very well. एक बारी जोरदार तालियां बेटा आप सबके लिए. And those who could not answer properly, no need to be worried, guys. Now the second question coming on your screen. So from the second question, again you can answer properly, right, beta? No problem. So I hope now the refractive period is clear in your mind that this is the 2 type and how you should answer. Now let's talk about the question number 2. Yes, beta. Yes. So now please answer question number 2. The question number 2 states, identify the type of cell membrane transport illustrated in the image below. And this is the image. And option number B is facilitated diffusion. Option number A is facilitated. B is active transport. C endocytosis. And D is passive diffusion. Yes, beta. Yes, Saeed. We are going to discuss about the cardiac action potential as well. There is another question regarding for that. So don't worry. Please answer at the moment this question number 2. Yes, beta. Yes. So identify the type of. Okay, I am going to enlarge the image for all of you. This is the image. So as you can see that this is your cell membrane. As I told you during the classes that cell membrane, it is a bilayer structure of the lipid layer. So it is lipid bilayer present over here, and in between there is a protein layer, right, beta? So this is the protein. Yes, everyone is right. Everyone is right. Very good. Wonderful, guys. Wonderful. Very well done. अरे वाह बेटा, आपकी तो प्रिपरेशन बड़ी जबरदस्त है. बहुत जबरदस्त प्रिपरेशन चल रही है मेरे को लगता है. यस. तो अब Membrane transport question is not going to be wrong from your side at all now onwards. I hope so. Yes, very good. Very good, guys. Very good. So as you can see that in this picture, this is mentioning that extracellular space and this is the intracellular space. And we know in between this, what is this structure? This is your cell membrane. So this is your cell membrane, right, beta? Now we know that cell membrane mainly consisting of the protein and the lipid. So this is the lipid part, this is the lipid part, and this is the protein part. This is the protein part, and it is also mentioning over here that here it is the carrier protein. And I told you that whenever there is a carrier protein is present, it means somebody is providing the facility for transporting a molecule across the cell membrane. So this is a type of facilitated diffusion. Now please answer me that facilitated diffusion, it is active or passive diffusion? Please answer me. Please answer me. Facilitated diffusion, it is active diffusion or passive diffusion? It is which type of diffusion this is? Yes. Please answer me, beta ji. Yes. Yes, please answer. आज बड़ा मजा आने वाला है आज के सेशन में. Yes. Yes. Facilitated, beta, facilitated diffusion. Facilitated diffusion, it is the passive diffusion. Very good, very good. It does not require the ATP. Remember, I told you that diffusion is two types, active and passive. Active and passive. Active diffusion required the ATP or the energy, and passive diffusion no required any ATP or no energy is required. So facilitated it is a type of passive diffusion. So right answer of this question is A. Right? So right answer of this question is A. So as you can see in this picture, just remember one more time that transport across the cell membrane via the active and the passive. Active means ATP required. Active means ATP required. ATP required. And passive means no ATP required. No ATP required. Right, beta? Very good. So as you can see, active, it is the primary active. Two types, primary active and the secondary active. Secondary active, it is also called as counter transport or antiport, or the co-transport, symport or uniport, that we have also discussed during the classes. And the passive, this is two type, diffusion, basically the simple diffusion, facilitated or the non-ionic, and another one, that is the last one, was the osmosis, right, beta? So all of the example and everything we have been discussed many times in the class. So I hope you can easily remember. Now please answer me. Please answer me that SGLT. Please answer me that SGLT, it is a which type of transport? SGLT, it is a which type of transport? Please answer me. Yes, guys. SGLT, it is a which type of transport? Yes, guys, please answer. It is which type of transport? Yes. Very good, Sachin. Very good. Ram Narayan, Ankit, everyone. Yes. Anuj, Vishnu, Shekhar. Yes. Jaman. Very good, guys. Everyone. So SGLT, it is the secondary active transport. Secondary active transport. Please tell me. Please tell me. Yes, beta. Everyone. Everybody is right. Everyone is correct. Very good. बहुत बढ़िया, guys. Wonderful. Please tell me. Sodium potassium pump. Sodium potassium pump. Please tell me. Sodium potassium pump. Which type of transport? Sodium potassium pump. Yes, guys. Sodium potassium pump, it is a which type of transport? Yes, it is primary active transport. Primary active transport. Very good. So sodium potassium ATPase pump, it is a primary active transport. Everyone is good. Everyone is right. Very good, guys. Wonderful. तो अब ये क्वेश्चन तो अपना गलत नहीं होने वाला है बेटा. So now onwards, if you'll see whenever these such type of question that transport across the cell membrane, just see the image properly and then please answer properly. Right, beta? Very good. Very good. Well done. So now the third question on your screen. So here it is the third question. So let's come on the MCQ number 3. And the question number 3 is stating that in hyperkalemia, which of the following changes in muscle excitability is most likely to occur? Yes, guys. So question number 3 states that in hyperkalemia, which of the following changes in muscle excitability is most likely to occur? Option number A, that it increase the excitability due to decreased potassium ion concentration inside the muscle cell. Option number B, that increase excitability due to increased potassium ion concentration outside the muscle cell. Option number C, that decrease excitability due to increased potassium ion concentration inside muscle cell. Or option number D, that unchanged excitability due to balanced potassium ion concentration inside or outside of muscle cell. Please answer for question number 3. Yes. Beta, here is the catch. First of all, it is asking the definition that what is the hyperkalemia. When you will say that this is the hyperkalemia, hypokalemia, hypercalcemia, hypocalcemia, hypernatremia, hyponatremia, what is the definition of those things? So first of all, please identify. No. First of all, please see, beta. Here it is the catch. Yes. So first you should know, this question is asking basically the first thing that what you should understand that what is the definition of the hyperkalemia. So first you should answer what is the hyperkalemia, right? So now hyperkalemia or hypokalemia means whenever we'll say that there is something is hyper, we always say in regarding of outside of the cell, not the inside of the cell. Because please see over here, suppose this is your cell, right, brother? This is your cell. And nearby of this cell is the blood vessel. From where you are taking the sample? From the cell or from the blood vessel? You are saying that, sir, I just took the blood and now I am checking it. What is the concentration of the potassium? And you know that the concentration of iron, if present over here, the similar concentration will be present into this interstitial space as well. So it means whatever you are drawing from this area, it means this is the concentration from the outside cell or from the inside of the cell. Exactly. This is the outside of the cell. So whenever we are telling that this is hyperkalemia, hypokalemia, hypercalcemia, hypocalcemia, hypernatremia or hyponatremia, we always telling the condition of that ion outside of the cell or particularly in the blood, not inside of the cell. So first of all, please see. In hyperkalemia, so now you know in hyperkalemia means more potassium concentration where beta? Outside of the cell, right beta? Outside of the cell. So first of all, jitne bhi inside wale hai, whatever inside written in the option, just rule it out. So now you can see that here it is the inside, it means this is the wrong option. Another one, here it is the inside, means again this is the wrong option. And number 3, again here it is the inside present, means again this is the wrong option. So it means 2 things is asking in this question. If you know even the one thing, you can easily rule out the remaining of the options. Even you don't know that what will be happen with the excitability of the cell, but you know that what is the definition of the hyperkalemia, and you know the potassium ion concentration in hyperkalemia must be increased outside of the cell, and outside of the cell is remain only in the one option. So beta, immediately you got your answer So right answer of this question is B. So beta dekha, this is how, if you know the basics, if you know the definition of the particular part, you can easily mark the right MCQs, right beta? So now let's see the second part, that which of the following changes in muscle excitability is most likely to be occur. So beta, whenever you know, initially when this cell, we know that inside of the cell already the potassium is high. Mainly where the potassium lives, inside of the cell. We know that house of the potassium is inside of the cell. Now during the repolarization phase, just only before the first question, in the first question about this question, we just only discussed that during the repolarization means this cell is going again to the negative side. And how this cell can become the negative again? This will start losing the positive ion from inside to outside of the cell. And which positive ion will move outside from the cell? The potassium start moving out. But as we are telling that outside already potassium is high. Outside is potassium is already high, because we know that this potassium was moving to the outside due to the concentration gradient, because we know that always ion moves from higher side to lower side, and initially there was potassium only was present mainly in the inside. So now when it want to become the repolarized or want to become the negative, that potassium start moving outside from the cell. But inside already is high and outside is now is high. So can this potassium move outside from the cell? No beta, because inside it is high and outside it is high. So it will become the balanced condition. Now this potassium cannot move outside and this cell will remain more positive side. So that is why the excitability is going to be increased initially. So this is the right answer of this question, that it increased excitability due to increased potassium ion concentration outside of the muscle cell. Right, beta? So now I hope that this type of question is now clear in your mind. And now my question is that, in which condition or what is the normal scenario the patient, you will get the patient where the hyperkalemia is present? In which condition and what are the causes of the hyperkalemia? Please tell me. Yes. Yes, beta. Please tell me, in what are the causes of the hyperkalemia? What you think? In which condition you can see the hyperkalemia inside of the patient? Yes. Please answer me. Yes, guys. Yes. So look at over here. There are the some cause which leads to the hyperkalemia. Means this is the too much potassium. And how much potassium? This must be more than 5 milli equivalent per liter. Right, brother? Yeah. So some causes like metabolic acidosis, then hyperglycemic hyperosmolar state. In this state, we gives the insulin infusion to the patient. Then the medication like potassium sparing diuretics. And what is the name of the potassium sparing diuretics? Right, beta? This is spironolactone. Yes, spironolactone. Then the muscle injury. If anybody is having the RTA, road traffic accident, due to the muscle injury or the crush injury, hyperkalemia can be present, or acute or chronic kidney diseases can lead to the hyperkalemia. What is the changes in the ECP? Is in the ECG you can see in the hyper or hypokalemia. So I told you the tall tented T wave. So you can see the tall T wave, in hyperkalemia. Yes. So tall T wave in hyperkalemia and depressed T in hypokalemia. So this is your normal T wave in the ECG, but in hyperkalemia you can see the wave is very, very much peaked. So this is tall T wave, right, beta? So this is how you can easily understand the hyper or hypokalemia. Yes, beta. Very good. Yes, yes, Mayank, it is rhabdomyolysis. Rhabdomyolysis. Yes, beta. Yes. Rhabdomyolysis it is. Spironolactone. Right, beta. CKD, ADH blocker. Everyone is right. Everyone is right. Very good, beta. Yes. So now talking about the next question. Question number 4. The question number 4. Now first tell me this graph. What is this graph? This graph from where? Please tell me. Please answer me. From where this graph is? किस चीज का ग्राफ है ये? Yes, beta. Yes. So this is ventricular action potential. Yes. So this graph is ventricular action potential graph. Right? Ventricular action potential graph. Now, yes. So now question number 4. That all are the true statement of the ventricular action potential showing in the image below except. Right, beta? So all are true except. Right? So now please look one by one. Yes, beta. So what is happening in the phase 0? Yes. So option number A, that phase 0 correspond to the rapid depolarization due to the opening of voltage gated sodium channel. Yes. So please answer me one by one. Option number A is phase 0 correspond to the rapid depolarization due to the opening of voltage gated sodium channel. It is true or wrong? It is true or false? Yes, guys. It is true or false? Yes. Now the option number B is phase 1 characterized by initial repolarization which involves the transient inward potassium current. Then the option number C is phase 2 plateau phase primarily due to the balance between the inward calcium current and outward potassium currents. And option number D is phase 3 repolarization mainly driven by delayed rectifier potassium currents. Yes, guys. So please answer me the question number 4. Please answer me. Yes. Now please answer me for the question number 4. It is A, B, C or D. Yes. Very good. Jaya Vajpayee. Very good, beta. Anuj. Mayank. Very good. Very good. Akhil. Yes. So question is asking all are true statement except. So option number A, we know that in this phase basically the sodium influx will be there. Sodium influx will be there. Option number phase 1, in the phase 1 that potassium will start moving outside. Potassium start moving outside. Right? Start moving outside. So this is basically the initial repolarization phase. Initial repolarization phase. And phase 2 is plateau phase. This is the plateau phase. So this is your plateau phase. Right, beta? In this plateau phase, calcium will move inside and potassium will move outside. So that is why it is making the balance. One positive ion moving inside and one positive ion is moving outside. After that, in this phase 3, it is the repolarization phase. And in this, the potassium start moving outside of the cell. This lead to again then more negativity inside of the cell that lead to the become the polarized state. So this fourth number is polarized state. So as you can see that in this phase the potassium is moving outside. Potassium is moving outside, not the inside, right, beta? So now you can see the option number B, that phase 1 characterized by initial repolarization which involves transient inward potassium currents. No, beta, it is outward potassium currents. So the right answer of this question is B. So B is stating the wrong options. This is the wrong statement. This is not the inward, this is the outward potassium current. So I hope now you can easily understand this ventricular action potential. Let's talk about that question number 5th. Refer to the image below which depicts the various respiratory volume and capacities. Identify the respiratory capacity labeled as X in the image. Right, beta? So please answer for question number 5th. Yes. So question number 5th. Please answer for question number 5th. Refer to the image below which depicts the various respiratory volumes and the capacity. Identify the respiratory capacity labeled as X in the image. Right. So here it is the X. This is your X. And please tell me what is this X? What is the right answer? Oh my God. Very good, beta. Very good. Wonderful. Salute है बेटा आप सब लोगों को. You all are champions. और जिस हिसाब से आप लोग आंसर कर रहे हैं बेटा, this is amazing. It feels me the more happy. I am very much happy that I am seeing this such type of answering, that when you are answering in such a manner that beautifully you are answering all of these questions, beta, really it makes me more happy. Really beta. Indeed, I am really happy to watching your answer on my screen. Really बेटा, to salute आप सब लोगों को salute है बेटा. बहुत मेहनत कर रहे हो बच्चे आप लोग. Definitely I pray to the God कि बस वो आपकी इस विश को पूरा करे, and all of you are going to pass on 6th of July बेटा. Right, very good. So right answer of this question is C. That is no beta. Sorry, this is not the C. This is right answer of this is D. So this is the right answer of this question is D. That is vital capacity. This is the vital capacity. Right, beta? Pardon? So right answer of this question is D. That is vital capacity. So I told you that this area. What is this area? This is your, what is this? This is your tidal volume. Then this is your IRV. This is your ERV, expiratory reserve volume, and above one is inspiratory reserve volume. This one is the vital capacity, and this is your total lung capacity. Talking about the capacities, one more. What is this remain? This is the residual air which is always present inside of the alveoli. So this is called as residual volume. Right, beta? Residual volume. And together this we called as FRC. This is called as functional residual capacity, FRC. Right? So I hope now it is clear that this is your vital capacity. So question number 5th, the right answer is D, that is vital capacity. Right, beta? Very good. Here are the different values. The tidal volume normally this is 500. Inspiratory reserve volume that is 3000. Expiratory volume that is 1100, and the residual volume that is 1200 ml. Talking about the capacity, the inspiratory capacity that is the tidal volume and the inspiratory reserve volume, so it will become the 3500. Functional residual capacity that is your expiratory reserve volume and the residual volume that is 2300 ml. Vital capacity that is IRV, TV and ERV. So all together this is 4600, and total lung capacity is around 5800 or the 6 liter. Right, beta? Right. Okay. Now let's talking about the next question. Question number 6. That which of the following is a characteristic feature of histotoxic hypoxia? Right. So please answer me the question number 6. That which of the following is a characteristic feature of histotoxic hypoxia? Right, beta. So please answer me for question number 6. What you think that what is the right answer of this question number 6? Yes. Yes. Question number 6. Option number A is decreased oxygen carrying capacity of the blood. Option number B, the impaired diffusion of the oxygen across the alveolar capillary membrane. Option number C, the inability of tissue to utilize oxygen despite adequate delivery. Option number D, the reduced partial pressure of oxygen at high altitude. Yes, beta. So please answer for question number 6. It is asking about the histotoxic hypoxia. So basically, this is asking about the histotoxic hypoxia, right? 4 type of hypoxia we studied in the class. That number 1, that is hypoxic hypoxia, anemic hypoxia, ischemic hypoxia, that is also called as stagnant hypoxia, and the last one, that is your histotoxic hypoxia. Right, beta? Yes, everyone is right. Yes, beta. Yes, 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 yes. Very good. Sagar, think again, beta. Think again. What is the question is asking? So as you can see that in histotoxic hypoxia, in the class, I told you that these are the lungs. Suppose these are the lungs, and here this is the blood vessel. And this is your cell. This is your cell. I told you. So once the oxygen will enter from the atmosphere into the lungs, it will diffuse from the alveoli and will mix into the blood. Now into the blood it will sit into the hemoglobin, and through this hemoglobin it will reach up to the cellular level. Now from the at the cellular level or the tissue level, this oxygen will enter into the cell, and from the cell CO2 will excrete out, and again it will mix into the blood, and through this blood again it will reach into the alveoli area. It will diffuse back, so CO2 will be excrete out from the body and oxygen start uptaking. This is how basically this functionality of oxygen uptake and CO2 excretion is happens. So now you can see that this oxygen which you are consuming, this must be reached up to the cellular level. वहां पहुंचना जरूरी है. And what all are the pathways from where this oxygen will start moving out up to the tissue level? So I told you, if there is any problem at lung or alveolar level or due to outside problem of the atmosphere, this is leads to the hypoxic hypoxia. Hypoxic hypoxia. If there is a problem of the Ola Uber, nobody is there or someone is already busy with someone, so this is called as anemic hypoxia. If there is a traffic jam over here, which is the landslide, this is called as ischemic hypoxia. Again, all of these 3 conditions, the delivery of oxygen up to this level will be decreased, right? But in histotoxic hypoxia, histo, that we are using the word for the tissue, so some problem at the tissue level, right, beta? Some problem at the tissue level, it means all of these pathways are actually functioning normally, but when oxygen delivers up to this area, due to the problem of the membrane or the cell, this oxygen is not enter inside of the cell, hence no oxygen delivery happens inside of the cell, leads to hypoxia, right, beta? And this is called as histotoxic hypoxia. Histotoxic hypoxia. So now you can see easily, that here the question is asking which of the following is characteristic feature of the histotoxic hypoxia. Number 1, the decreased oxygen carrying capacity of the blood. No, that is anemic hypoxia feature. Then impaired diffusion of oxygen across the alveolar capillary membrane. This is at the lung level, so this is hypoxic hypoxia. Then inability to tissue to utilize oxygen despite adequate delivery. Yes, delivery is properly happening over here, but it cannot enter inside of the cell. So definitely this is about the histotoxic hypoxia. And reduced partial pressure of oxygen, again this is the type of hypoxic hypoxia. So I hope now you can easily understand or you can easily remember all the different type of hypoxia, right beta? So right answer of this question number 6 is C, that is inability of tissue to utilize oxygen despite adequate delivery. Now let's talk about the question number 7. Which of the following statements about the lung surfactant is correct? So now the question from the surfactant, most expected topic for upcoming FMG exam. Which of the following statement about the lung surfactant is correct? Option number A, that lung surfactant is primarily composed of mucin proteins that help trap the pathogens. Option number B, that lung surfactant reduce the surface tension within the alveoli and preventing them from the collapsing. Option number C, that lung surfactant is secreted by the type 2 alveolar cells and primarily acts as an immune defense. Option number D, that lung surfactant production increase with age leading to increased lung compliance. Yes, beta. So it is asking the correct statement. First of all, just see, this is asking the correct statement, not the wrong statement. What is the correct statement? Yes. Yes. Somebody is saying, many of you are saying B, but few of you are saying that option C. Okay. Yes, बहुत बढ़िया बेटा. You are moving on the right direction. Very good. Yes, guys. Well done. So right answer of this question is option number B. That is, the lung surfactant reduce the surface tension within the alveoli and it preventing them from the collapsing. But somebody who are saying that, yeah, Sundar, B and C. But C, what the option number C is stating? I understand that option A, ये तो easily rule out हो गया, ये तो कोई लगाएगा ही नहीं, right? Why? Because this is not made up of the mucin proteins. But surfactant is mainly made up of the lipids. And which lipids? That is the phospholipids. That is phospholipids. And which phospholipid? That is your DPPC. That is also known as lecithin. Lecithin, or also called as dipalmitoyl phosphatidyl choline. Dipalmitoyl phosphatidyl choline, which is also known as lecithin, right? So this is the major surfactant. This is your major surfactant. And which one is your minor surfactant, guys? Which one is your minor surfactant? That is your sphingomyelin. Sphingomyelin, right, beta? Yes. And what is the function of this surfactant? Basically, it reduce the surface tension and it increase the compliance. And what is the compliance? Compliance means stretchability of the alveoli. तो alveoli के अंदर अगर हवा जानी है तो बेटा alveoli must be stretch up, and this alveoli is stretching means this we call as compliance, and this surfactant increase the compliance and it decrease the surface tension. So basically option number A is stating that this is made up of the mucin protein. No, this is made up of the phospholipids or the sphingomyelin, right beta? Option number D, that is lung surfactant production increase with age. No, I told you that this is always decrease with age. That is why in the senile age group or in the aged peoples, but due to the less surfactant, the lung compliance is decreased. Hence, the total lung capacity of the senile age group persons are decreased. So again, this is the wrong options. Now, option number C. Beta C, the lung surfactant is secreted by type 2 alveolar cells. Yeah, this up to this area or up to this point, this is correct statement. But and primarily, beta, this is not primarily act as an immune defense. Primary function of surfactant is not the immune defense. Primary action that decrease the surface tension. Secondary function, it can be immune defense. So thus catch between B and C only this primarily, right बेटा? अगर ये primarily यहाँ mention नहीं होता और simply अगर ऐसे होता it act as an immune defense, it could be a right options as well. But as in the question it is saying it is primarily act, no beta. The primary function of the surfactant is always decrease the surface tension and increase the compliance. It can be the secondary function as an immune defense. So the right option of this question number 7 is B, that is lung surfactant reduce the surface tension within the alveoli and it preventing them from the collapsing, right? So basically it increase the compliance, means now it is going to be stretched more, it is not going to be collapse. Now this right answer of this question number 7 is B, right beta? Yes Sachin, so word का खेला है. Yes beta, that is absolutely the true words. ऐसे ही एग्जामिनर आपको एग्जाम के अंदर क्वेश्चन देता है बेटा. सो ऑलवेज यू शुड बी मोर कॉन्शियस अबाउट द ऑप्शंस एंड अबाउट द क्वेश्चन, दैट व्हाट द एग्जामिनर इज आस्किंग एंड व्हाट इज द कैच इनसाइड ऑफ द ऑप्शंस आर देयर, राइट बेटा? सो ऑलवेज बी कॉन्शियस, राइट बेटा? नाउ द नेक्स्ट क्वेश्चन इज क्वेश्चन नंबर, यस बेटा, सो नाउ द नेक्स्ट इज क्वेश्चन नंबर 8. So which of the following condition is most likely to increase the glomerular filtration rate? Yes, beta. Yes. So now, yes, Sundar, this is the time for the World Cup. T20 World Cup is going on, but your World Cup is on 6th of July, right, beta? So don't worry. This is the time to spin the ball. और अभी तो spin का ही खेल चल रहा है बेटा सारा, right? So now please answer for question number 8. That which of the following condition is most likely to increase the GFR, right? So it is asking about increasing the GFR. Yes, option number A is diabetes mellitus with nephropathy. Option number B, the hypotension due to severe dehydration. Option number C, the atherosclerosis affecting the renal arteries. And option number D, the administration of the vasodilator medications. Please answer me. Yes, guys. Many of you are saying the right option is D. Some of you are saying the right option is C. Okay, so confusion and Sharma's, you are saying it is A. Okay. Again C beta. Again read the question one more time. Please read the question one more time. That which of the following condition is most likely to increase the GFR? It is not asking decrease the GFR beta, right? So please first look at in this picture. This is your Bowman capsule. This is your afferent arteriole. This is your glomerular tuft. And this is your efferent arteriole, right beta? Efferent arteriole, and in between of this area, this is your basement membrane, right? So please tell me, what is the GFR? GFR means the rate of filtration, means any product which is coming over here, how much this product will come into this area. This is we called as glomerular filtration rate. So at which rate the filtration is going on up from this area, So now, whenever we are talking that this filtration is increasing, right? If we are talking like this, it means first of all, the more amount of blood can increase the filtration into this area. We know it. But if you decrease the blood supply, if you will decrease the blood supply or blood is coming very less, what about the filtration? Filtration will also decrease. So please look at one more thing. So please look at in the options. Hypotension due to severe dehydration, beta, less water inside the body. Hypotension, less amount of blood is reaching into this area. What about the filtration? It is going to be decrease. So from this, it is going to be decrease. Diabetes mellitus with nephropathy, right beta? If this area is damaged, why damage? Due to the diabetes. So in diabetes, there is a immunocompromised condition. There is less immunity of the person. What could be happen? This area is going to be damaged. And if this barrier is going to be damaged, what could be happen? Can you imagine filtration can be increase or decrease? Right, beta? So absolutely the filtration is going to be decrease. So again, diabetic nephropathy is decrease the GFR. Diabetic nephropathy is decrease the GFR. Number 3, atherosclerosis affecting the renal arteries. Again, if there is any constriction into the renal artery, suppose here is the renal artery, or if any constriction occurs over here, again, what you think that more amount of blood can pass through this area or less amount? Obviously, beta, this is going to be the less amount. And again, if less amount will reach into this area, what about the filtration? Filtration again going to be decrease, right, beta? So this atherosclerosis affecting the renal artery is again going to be decrease. And the administration of vasodilator medication. Vasodilator medication means it will dilate the arterioles. It means it will dilate the capillaries, and what could be happen, beta? The more amount of blood will reach into this area. And if more amount of blood will reach into this area, certainly the little amount of GFR will be increased, right? So this right answer of this question is administration of vasodilator medication, right, beta? Yes, Sachin, if efferent arteriole, yes, beta, if you will constrict this area, initially GFR will be increased, but later on it is going to be decreased because this area is getting out any fluid which is present behind through this area very slowly. So initially the hydrostatic pressure of this area is going to be increased. This is going to be increased, so filtration will be increased. This lead to increased filtration initially, but later on no more new fluid is coming. So what is going to be filter? Nothing. अब तो कुछ बचा ही नहीं हुआ फिल्टर होने के लिए, जितना फिल्टर होना था वो हो गया और अब इसको बाहर निकलना है ताकि वहां से दूसरा पार्ट आ सके. So that is why efferent arteriole constriction initially it increase the GFR followed by decrease the GFR. So right answer of question number 8 is D, that is administration of vasodilator medications. Yes. Now, question number 9. Which of the following is best defines the renal clearance? Again, googly. एक और दूसरा आ गया है बेटा. Now, again, a दूसरा over here. So, please answer question number 9. That which of the following is best defines the renal clearance? Option number A, the rate of which a substance is excreted by the kidney. Option number B, the rate at which a substance is filtered by the glomeruli. Option number C, the rate of a substance is reabsorbed, the rate at which a substance is reabsorbed by the renal tubules. And option number D, the rate at which a substance is metabolized by the kidney. Yes, guys. Yes, please. Please answer question number 9. Yes. So please answer question number 9. Yes. Yes, guys. Okay. So, beta, I told you some googly is there, right? Okay. So, कुछ लोग कह रहे हैं it is A, somebody is saying it is B, somebody C, and I can't see anybody saying the D. Okay. So, D, everybody is ruling out. So, D is not the right option. Okay. So, here, few of you are saying it is A, some of you are saying it is B, some of you are saying it is C. Okay. It means now, confusion between A to C. Okay, let's discuss one by one and let's discuss from downside to upside. So let's talk about first of all option number C. Option number C states the rate at which a substance is reabsorbed by the renal tubules. Better reabsorbed by the renal tubules. This is not the definition of the clearance. Clearance means that any substance which is moving out from the kidney, any substance which is moving out from the kidney, or ultimately it is moving out from the body. So this is called as renal clearance, means any substance will need to be cleared off by the kidney at how much rate or at how much speed. This we called as renal clearance, right? Yes. So now you got your answer. This again a wrong option. This is not about the reabsorption of any substance, right? Then option number B, the rate at which a substance is filtered by the glomeruli. No. Again, this is not the right definition of the renal clearance, because this is about the filter load. This option B states about the filter load, and option C states about the transport max, T max. During the class, I told you the T max and the filter load. So option B and C, they both are telling about, this is about the transport max and this about the filter load. So again, this is the wrong option. Option number A, the rate at which a substance is excreted by the kidneys. Yes, this is called the renal clearance. Always remember. So this is the right answer of question number 9. Right, beta? Okay, very good. So now come to next question, question number 10. That which of the following condition is characterized by a primary metabolic acidosis? आ गया बेटा आपका question A, B, G, that is pH, right beta? So now the question from the pH, that which of the following condition is characterized by a primary metabolic acidosis? Okay, but here is no values given. No value is given. You are finding, sir, where is the pH, sir, where is the PCO2, sir, where is the bicarbonate? No better. So this is direct question. So which of the following condition is characterized by a primary metabolic acidosis? Option number A, hyperventilation, B, COPD, C, excessive alcohol consumption, and D is severe diarrhea. Please answer. Please answer for question number 10. Again, some of you are saying it is A, some of you are saying it is D, then C and B. Okay. Beta C over here, it is asking about the metabolic acidosis, right? So it is asking about the metabolic acidosis, means body inside of the body condition pH is decrease, means this is less than 7.35. Then it will become the acidic, right brother? Then it will become the acidic. Number 1, in hyperventilation, what will be happen in the hyperventilation? When you are going at the higher altitude, there is the low barometric pressure or atmospheric pressure lead to the decreased partial pressure of the oxygen, hence no oxygen will move inside. This lead to the hyperventilation for the body. So hyperventilation means you are taking more CO2 outside from the lungs. Yes, beta, you are taking out more CO2 from the lungs, and CO2, you know that CO2 property is always acidic. It means acid, more acid is going outside from the lungs. That lead to remain inside of your body more alkaline. So ideally, hyperventilation leads to body alkaline, not the acidic. So this is wrong option. Number 2, COPD. COPD again. COPD, it is the problem in inhalation or exhalation. This is a restrictive lung disease or obstructive lung disease. Please. So you know that COPD, it is the OLD, obstructive lung disease. And in obstructive lung disease, problem is always in exhalation. Right, beta? So what is happening? More CO2 present inside of the body, and this CO2 is moving not properly out, right? So this ideally should make respiratory acidosis. This should make respiratory acidosis, but here it is metabolic acidosis. Option number C, excessive alcohol consumption. Beta, whenever there is excessive alcohol consumption, what happens, beta? There is more and more acid formation presents inside of the body, like lactic acid formation becomes more. So basically, body will become more acidic now, right, beta? but this is not the primary part. Now what will be happen, beta? In the option number D, this excessive alcohol will also lead to what? This will lead to vomit. When person will be start vomiting out, what will be happen? More acid content will go outside, so body will become again the alkaline, right, beta? So now option number D is severe diarrhea. Beta, what happens in the diarrhea? What happens in the diarrhea? You know that diarrhea means this is your stomach, this is your stomach, this is the duodenum, this is jejunum, this is ileum, and then this is the colon, right, Buddha? And ultimately here it is the rectum. So what is the diarrhea? Diarrhea means from this area up to this area, any content present into this area, this start moving out from the body. It means we know into the duodenum there is more alkaline secretion present from all over the glands. So all the alkaline which is present into the digestive tract, it is washing out from the body. So if more alkaline start washing out from the body, how the body will remain? Body will remain the acidic condition. So this lead to what? This lead to metabolic acidosis. So primary metabolic acidosis is due to severe diarrhea. Means all the bicarbonate content which is present inside of your gut, this is going to be washed out, and if bicarbonate content will remain less, this lead to metabolic acidosis, right, beta? Yes, beta, this is due to bicarbonate ions, right, beta? Right. Now the question number 11, identify the cell signaling mechanism shown below in the image. So I am going to zoom for you. I'm going to zoom in for you this image. So please see which type of cell signaling this is. Which type of cell signaling this is? Yes, guys. So it is which type of cell signaling? Please answer me. Question number 11. Identify the cell signaling mechanism shown below in the image. Yes. So 4 type of cell signaling we have been studied, right? Autocrine, then through the gap junction. Through this gap junction, we also called as contact dependent signaling. Then we studied the paracrine and then the endocrine signaling. So as you can see, this is the secretory cell and this is the adjacent target cell, and this is passing a ligand from one cell to the another cell. This is a type of paracrine cell signaling. This is a type of paracrine cell signaling, right, beta? So this is a type of paracrine cell signaling, right? Okay, so these are the different type of cell signaling. As you can see, this is your endocrine cell signaling. This is your endocrine cell signaling. Then this is your paracrine cell signaling. This is your autocrine cell signaling, and this is contact dependent, which is signaling through the gap junction. Yes. So if any cell target to the nearby cell without any contact, this we call as paracrine cell signaling. But when a cell target to a distant cell, means some cell is present over here and it try to target up to this area, so it will target via the blood stream only. So it will mix its chemical into the blood, and through this blood it will reach up to this area. So this we called as endocrine cell signaling, right, beta? Endocrine cell signaling. Yes, beta. Padosi ko. Yes, very good. So this is a type of paracrine cell signaling. Very good. Question number 12. That which of the following statements accurately describe the function of the basal ganglia, right? So question from the CNS, that basal ganglia, you know that what is the ganglia, end-to-end junctions of the nerve fiber. So this is basal ganglia. Actually, it should be nucleus because it is inside the CNS, but this is the misnomer for the nucleus. This we call as basal ganglia. So what is the right options of this question number 12? So first option is the basal ganglia are primarily responsible for the coordination of fine motor movements and maintaining balance. Option number B, the basal ganglia play a significant role in the regulation of heart rate and the respiratory rhythm. Option number C, the dysfunction of the basal ganglia is primarily associated with sensory processing and perception. Option number D, the basal ganglia are involved in the regulation of emotions and the memory consolidation. Please answer me. Yes. Yes. सचिन सीधा बेटा हेमी बैलेस्मस. यस, हेमी बैलेस्मस के ऊपर चले गया सीधे. राइट. ओके. So now, yes beta, many of you are right. Yes, very good guys, very good. So right answer of this question is option number A. Option number A. This is the right option, that basal ganglia are primarily responsible for coordination of fine motor movements and maintaining the balance. So I told you that basal ganglia, basically it is situated on the base part of the brain, right? And there are the total 5 types of basal ganglia that we have been already discussed in the class, that is caudate, putamen, globus pallidum, subthalamic nuclei and the substantia nigra. And in this, the most important was the subthalamic nuclei, and this subthalamic nuclei, it is having the neurotransmitter called as glutamate, and this is the most excitatory neurotransmitter of the brain. So this subthalamic nuclei, when it is lack of this glutamate, this can lead to a involuntary motor conditions called as hemibelesmus, right? So this basal ganglia basically beta, they will decide. Suppose you are planning to do any action. Abhi aapko suppose you want to write. At what speed you should write, in which direction you should write, how tightly you should hold the pen. This is who is maintaining all of this condition. All of this condition is maintained by the basal ganglia. But you are holding this pen, so primarily this is responsible, that frontal part or frontal lobe, that is the motor strip. So motor strip ne command diya that you have to hold this pen and you have to write. But what should be your speed to writing, how tightly you should hold your pen, and in which direction you should write, who is telling all of this condition? This is telling by the basal ganglia. So this basal ganglia is primarily responsible for the coordination of fine motor movements and the maintaining the balance. Right, beta? Right? So please see some of the functions of the basal ganglia. It controls the voluntary motor activity. Second, it is control the reflex of muscular activity. Third, it is control of the muscle tone, and it role in arousal mechanism as well. Yes, beta. So in arousal mechanism as well, it is the function, right? So this is the right answer of this question number 12 is the basal ganglia are primarily responsible for the coordination of fine motor movements and maintaining the balance, right? Very good. Now the next question. The next question again from the CNS. Which of the following condition is associated with subthalamic abnormal activity or the dysfunction of the nucleus, that is subthalamic nuclei? STN stands for subthalamic nuclei. Subthalamic nuclei. Right, beta? So what is the condition or which disease pursue when there is a problem in the subthalamic nuclei? Option number A is hemibelesmus, then B is Alzheimer's disease, C is multiple sclerosis, and D is chorea. Right. Yes, beta. Very good. Yes, yes, guys. Very good. Well done. Well done, guys. Well done. एक बार जोरदार तालियां आप सब लोगों के लिए बेटा. Very good. Superb. Brilliantly you are answering, guys. Well done. So right answer of this question is yes. It is hemibelesmus. It is hemibelesmus. Right? So hemibelesmus, it is the involuntary motor activities, that there is a flinging of the arms and everything. This is the problem of the subthalamic nuclei, and which neurotransmitter is absent? That is your glutamate. Which neurotransmitter? That is your glutamate. Right? This is glutamate. Alzheimer's disease, you know that this is due to the deposition of tau proteins. Tau proteins, भूलने वाली बीमारी. Right, beta? Then the multiple sclerosis. Yes, please tell me. Multiple sclerosis. It is the problem of which cell? And in which area? Yes, multiple sclerosis. Yes, guys, multiple sclerosis. It is the gene mutation or abnormality of which cell? Oligodendrocytes, which basically make the myelin sheath of CNS, which makes the myelin sheath of the central nervous system. And this myelin sheath provide the faster conduction. Faster conduction. Remember? So this myelin sheath is made up of by the two cells, that is number one, your oligodendrocyte, that is in the CNS, then the Schwann cells, that is in the peripheral nervous system. If peripheral nervous system Schwann cells is damaged, that we call as GBS, Guillain-Barré syndrome. And if central nervous system myelin sheath is damaged, that we call as multiple sclerosis. And the chorea, it is the problem of, that is caudate and putamen. Caudate and putamen. Right, beta? Very good. Okay, well done. So right answer of this question number 13 is A, that is hemibelesmus. Now the next question is, which type of aphasia is characterized by the intact fluency and comprehension but impaired ability to name objects or find the right words? Please answer for question number 14. Which type of aphasia is characterized by intact fluency and comprehension but impaired ability to names the object or find the right words? Option number A, that is Broca's aphasia. B is Wernicke's aphasia. C is global aphasia, and D is anomic aphasia. Yes, guys. So please answer for question number 14. Yes. So as you know, you can remember this image, right, beta? Yes. This is the central sulcus. This is parieto-occipital sulcus. Here it is longitudinal sulcus. So you know this is the frontal lobe, this is parietal lobe, this is occipital lobe, and this is your temporal lobe. I told you during the classes that this area, temporal lobe, contains the center for understanding the language. Right now, whatever I am telling to you, you are understanding that part due to the presence of this center, and this is called as Wernicke's area. This is called as Wernicke's area. Then another center is present over here, that right now I am speaking. You are listening due to this area and I am speaking due to this area, and this is called as Broca's area. Broca's area, and both are connected together via arcuate fasciculus. Via arcuate fasciculus. Right? So somebody, first of all, he will listen and then accordingly he will answer appropriately. So this arcuate fasciculus, basically it is making connection between Wernicke's area and the Broca's area. And another area is present which is basically responsible for naming of the objects, that this is the pen, this is the coat, today is the class of physiology. So especially you are telling to any particular word or the name, this is due to this area called as angular gyrus. Angular gyrus. And if this area is damaged, beta, if this area is damaged, you can't properly name the object. And this, when you can't properly name the object, this we called as anomic aphasia. So this can lead to anomic aphasia. Anomic, जिसका आप नाम ना ले पाएं, this is called as anomic aphasia due to the problem of angular gyrus. Wernicke's area, this is the problem, that inability to comprehension of the language, or you can call this that this is the fluent aphasia or sensory aphasia, and this is lead to conduction aphasia. This lead to conduction aphasia, and a problem in the Broca's area happens, this can lead to the non-fluent aphasia. This can lead to non-fluent aphasia, also called as motor aphasia. And if these both area together, if both area is damaged, Wernicke's bhi gaya and Broca's bhi gaya, then together there is fluent and non-fluent aphasia, both are together. This we called as global aphasia. What we called is global aphasia. So I hope you can easily remember all of these areas. So question is asking that which type of aphasia is characterized by intact fluency and compensation. Means your Broca's is intact and Wernicke's is intact, but not impaired ability to name the object. It means which area is damaged, angular gyrus, and this can lead to anomic aphasia. Right, beta? So this is right answer of this question is D, that is anomic aphasia. Right? So I hope now it is easily understand or you can easily remember. The next question is, in skeletal muscle excitation contraction coupling, which of the following statement accurately describe the relationship between the DHPR and RYR? DHPR stands for dihydropyridine receptor and RYR stands for ryanodine receptor. Ryanodine receptor. Right, beta? So please answer for question number 15. Option number A, that DHPR acts as a voltage gated sodium channel that directly release calcium ion from the sarcoplasmic reticulum into the cytoplasm. Option number B, that ryanodine receptor acts as a voltage sensor on the T-tubule membrane, initiating the release of calcium ion from the sarcoplasmic reticulum into the cytoplasm. Option number C, that DHPR mechanically couples with ryanodine receptor, triggering the release of calcium ion from the sarcoplasmic reticulum in response to membrane depolarization. And option number D, that ryanodine receptor binds directly to troponin, facilitating the interaction between actin and myosin during muscle contraction. Yes. So please answer for question number 15. Well, sir, itna lengthy question. Beta, this is not a lengthy question. Sometimes nobody knows that in your examination, few questions can be lengthier, few questions can be the single liner, and few are with the image. So we must practice with the all expected questions and in the all manner, that the manner which is going to be asked in your exam as well. So basically, if you know the mechanism, question is very easy. So no need to be panic just seeing the lengthy questions. Okay. Yes. Yes, guys. So now please close your eyes for the 1 second or 2 seconds like this. Okay. Please try to calm yourself and now again start thinking about the questions. And think that you are not on the 15th question, that you are on the first question. Your brain will start giving you the more proper signal. Believe me, if you will practice such type of questions via thinking, just that this is the first question which you have to be solved, you will get the more energy to solve these questions. Right, Bada? Yes. So please answer for this question number 15th. First of all, you know that DHPR and ryanodine receptor. Remember this picture? Remember this picture? This was the myocyte. This was the myocyte. Here it was the sarcomere. Here it was the sarcomere. Here it was the sarcoplasmic reticulum, which is having the L tubules over here because it was in the longitudinal planes, and these are the T tubules over here because it is in the transverse plane. We know that on the T tubules there is presence of the DHPR, and here it was present the RYR. So please first of all tell me, this is the L tubule. So please tell me where the RYR is situated. Where the RYR is situated, on the T tubules or on the L tubules? First of all, please tell me where the ryanodine receptor is situated, on the T tubules or on the L tubules? Exactly, ryanodine receptor is situated not on the T tubules. On T tubule it is DHPR. On L tubule it is ryanodine receptor. So please look at option number B. It is stating that ryanodine receptor acts as a voltage sensor on the T tubule membrane. on the T-tubule membrane. This is wrong statement. This is wrong statement. It is not on the T-tubules, it is on the L-tubules, right, beta? Number one. Then how this DHPR and ryanodine receptor, it basically functions. So from outside, action potential comes. This trigger the DHPR. This DHPR mechanically attached with the ryanodine receptor. It will activate the ryanodine receptor. Hence, the calcium channel start opening and calcium start moving out, and it will going for contraction of the muscle. So this is how basically this DHPR, it activates the ryanodine receptor that triggers the release of the calcium from the sarcoplasmic reticula. This is the warehouse of the calcium called as sarcoplasmic reticula. So now please see the options. First of all, the DHPR acts as a voltage gated calcium channel that directly release the calcium ion from the sarcoplasmic reticulum. No beta, it is not, DHPR is not going to be directly released. It will trigger the ryanodine, that will open the calcium channel. So it is again the wrong statement. This is not the T-tubule, so again it is the wrong statement. Option number C, that DHPR mechanically couples with the ryanodine receptor, triggers the release of calcium ion from the sarcoplasmic reticulum in response to membrane depolarization. Right, this is the right option. Then D is ryanodine receptor binds directly to the troponin. No beta, it is ryanodine receptor will not directly binding to the troponin. This is the calcium which actually bind with the troponin C that we have already studied. It will bind with the troponin C. So right answer of this question is option number C, that DHPR is mechanically couples with ryanodine receptor, triggering the release of calcium ions from the sarcoplasmic reticulum in response to membrane depolarization. Beta, very much expected question this is. So please remember once again, please see the mechanism of this DHPR and the ryanodine receptor. Now the next question is question number 16. The baroreceptor detects the changes in blood pressure primarily by the responding to. Option A is changes in the blood osmolarity. Option B is changes in blood flow velocity. Option C is changes in blood vessel diameter. Option D is changes in arterial stretch. Yes, guys. Please answer for question number 16. Yes. Yes, guys. So for question number 16, please start answering. Yes. Very good, guys. Very good. Yes. So baroreceptor, we know the baroreceptor, it is the blood pressure measuring sensor. Blood pressure measuring sensor. They are present into the aorta and into the carotid artery over here and in aorta, and basically this is the aortic baroreceptor and this is the carotid baroreceptor, and they are basically checks the mean arterial pressure. And what is the range of mean arterial pressure, beta? This is from 70 to 150 mmHg. 70 to 150 mmHg. It means whenever the blood pressure is dropped below the 70 mmHg, they will trigger and immediately they will bring back to the pressure at normal level. If pressure is more than 150 mmHg into the blood vessel, they will trigger and basically they will try to drop the blood pressure again into the certain level or into the normal level. So basically they detect the mean arterial pressure, and they are situated into two areas. One, the blood supply which is going to the downside into the aortic area. One is going to the upside into the carotid area. Now, so basically they sense not the blood osmolarity. They do not sense for the blood velocity. They do not sense the diameter of the vessel. Basically, when the pressure is high into the pipeline, this pipeline will be stretched like this or it will decrease in the stretching. So basically, the baroreceptor will detect via the changes in arterial stretch. So whenever stretch is increased up, baroreceptor will detect. Whenever stretch is decreased up, this is going to be detected via the baroreceptor, and they are actually the blood pressure sensors. They are situated in the two area, aortic area and into the carotid area. Right, beta? Now, the next question is 17th. So at high altitude, which physiological adaptation helps increase oxygen delivery to the tissues? Please answer for this question. Question number 17 states that at high altitude, which physiological adaptation helps increase oxygen delivery to the tissues? Option number A, it decrease the ventilation rate. Option number B, via increasing the hemoglobin concentration. Option number C, decrease the erythropoietin production. And option number D, that increase the blood pH. Yes. Yes, madam. So please answer for question number 17th. At high altitude means barometric pressure is going to be decreased. Barometric pressure is going to be decreased so that partial pressure of gases is going to be decreased. So the diffusion at alveolar level is going to be decreased. So everything is going to be decreased. What will be happen? If less oxygen is coming inside, what you would like to do? You would like to do more and more respiration. Means you are increasing the respiratory rate. This will lead to hyperventilation, not the hypoventilation. So first option, it is stating decreasing ventilation rate. No, beta, this is not true. Option number B, that increase hemoglobin concentration, right? Beta C, when this less oxygen is coming inside of the blood, what this blood wants to do, the body adapts via increasing the hemoglobin, so that any kind of oxygen, when it enters into the blood, there should be sufficient hemoglobin should be present into the vessels, so that all the oxygen whatever coming into the alveoli, it must be diffused inside of the blood, and that can carry up to the cellular level. So basically body for the adaptation increase the hemoglobin concentration. So it is true statement. Number 3, the decrease erythropoietin production. Because this EPO, it helps for increase RBC production. So if you want to increase the hemoglobin, RBC is also going to be increased. So erythropoietin is also going to be increased, not the decrease. So again, it is the wrong answer. And then the increase the blood pH. Increase the blood pH. This is not the adaptation. This is due to the condition. There is increasing of the blood pH, means pH is more alkaline. So this is basically the condition. This is not the adaptation. Adaptation for the body, that body will increase the hemoglobin concentration. So right answer of question number 17 is B. Right, Vida? Option number B. Right? Yes. Now, question number 18. Mark the right sequence of renal filtered substance shown in the image. So I am going to zoom little bit for you this image. So as you can see into this image, this area, it is percentage of filter load which is remaining. This is Bowman capsule, this is PCT, DCT, and this area is the urine. This area is the urine. So one substance, this is another, this one, third one, this one, and this one. Right? So 4 substances are there. Please identify what is the right sequence for this given renal filtered substance. Yes, beta. A क्या है, B क्या है, C क्या है, D क्या है? Yes, beta. Yes, please answer for the question number 18. Okay, Sachin, 2 you got it. C is inulin and D is PAH. Very good, dear. Well done. Okay. Absolutely, absolutely, beta. Yes, wonderful, guys, wonderful. The right answer of this question number 18 is option number C. What this graph is actually telling? This graph is actually telling that substance is coming up to this level. At this level, it filters, and when it filters, it passes through the renal tubules. When it passes through the renal tubules, what happens, beta? Some of them, they will reabsorb back. So the concentration of those substances is going to be decreased into the urine, and some of them is going to be increased later on. It means they will secrete into the tubules later on as well. It means the concentration of those substances into the urine is going to be increased. But some of them, they will remain at the constant. It means later on, no reabsorption or no secretion will be happen of those substances. So now you can easily see, in according to this question, that option number A, this option number A, that's any substance which is initially filtered, it present up to the PCT, but later on PCT it is absent. And which substance is 100% reabsorbs at the PCT level? Either it is glucose or amino acid. So option number A, it is either glucose or either amino acid. Right, beta? So option number A, either glucose or amino acid. Then option number B. This point B, it is showing that initially it filtered a lot, but later on it reabsorbs, but still it is present into the urine. But concentration of that substance is very, very less. This could be your bicarbonate. This could be your bicarbonate. Now, point number C. Point number C. Point number C means any substance which is filtrating from this area, later on it is not reabsorbed, not secrete. Means whatever amount it is secreted or it filtered at the GFR or at the glomerulus level, it is remain constant into the urine later on as well. And this is your inulin. So I told you inulin never reabsorb, never secrete, and ideal clearance of the inulin from the body is 125. So that is why it is the best dye for measuring the GFR. Right, beta? And the option number or point number D, beta, means any substance initially filtered, but later on in the urine, the amount of this D substance is increased. It means it is secreted later on. And this is your PAH, which we also used for renal plasma flow estimation. So PAH stands for para amino hippuric acid. Para amino hippuric acid, para amino hippuric acid, and this is basically required for estimation of renal plasma flow. Renal plasma flow. Yes, very good. Yes, Sachin. Very good. So now you know all the substance one by one. So as you can see, A is glucose, B is bicarbonate, C is inulin, and D is PAH. So right answer of this question is option number C. Talking about the next question, that which of the following heart sound is associated with the closure of the atrioventricular valve, mitral or tricuspid valve? As in the question it is mentioned that AV valve, that is the 2 AV valve, mitral or tricuspid valve, and occurs during the systole. So it is asking about the heart sound. What is the right answer? S1, S2, S3 or S4? Yes, guys. Please answer for question number 19. Yes, Yashashvi, you are right, dear. It is C. For question number 18, the right answer is C. Okay. So please tell me for question number 19, what is the right answer? Which of the following heart sound is associated with the closure of AV valve and occurs during the systole? Well done. Yes. Very good, guys. This is your S1. So in the class, I told you that suppose this is your heart, this is right atria, right ventricle, left, sorry, left atria, right atria, left atria, right ventricle, left ventricle. We know that this wall, it is the tricuspid wall, and this wall, it is the bicuspid wall or the mitral wall, or together we can call it, it is AV wall, AV wall. And here it is pulmonary wall, and this is your aortic wall, and together we called as semilunar wall. Semilunar wall, right, beta? We know that first sound occurs due to the closure of this wall, and this lead to S1. And when it will happen? When this atria is contract, and this contraction is called as systole. So when this atria is contracting, this is called as atrial systole. After this atrial systole, all the blood went into the ventricles. Now this wall is going to be simultaneously going to be closed, and whenever these valves is closed, due to the closing of the door, it creates the sound. Similarly, when the wall is going to be closed, it creates the sound, and this creates the S1 sound. The S2 sound, this is due to the closure of semilunar wall. So this is aortic or pulmonary semilunar wall, right? So this is how S1 and S2 can be occurs. S3, this is due to the passive ventricular filling. That is, you know that this happens due to the rapid, and if there is any pathology, then the S4, this is due to again atrial systole, active ventricular filling, right? So these are the different heart sounds. Except these 4 heart sound, if any heart sound occurs into the heart, this we called as murmur. So any abnormal heart sound except these 4 known as murmur, right, Buddha? Known as murmur. So I hope you can easily remember. During the classes, we have been studied the different type of murmur as well. During the systolic murmur, diastolic murmur, pendiastolic, pensystolic, continuous murmur, all of the examples also we have been discussed during the class, right, Buddha? So this is the right answer of question number 19 is option number A, that is S1, right? S1. Now let's talk about the next question, question number 20, that which JVP waves correspond to the atrial contraction and occurs just before the first heart sound, right? So this is now talking about the JVP, jugular venous pressure, and you know jugular venous pressure, when we talked about the jugular venous pressure, we always talked about the pressure into the which chamber? Into the right atria. So we always talked about in the JVP the pressure into the right atria. So now you can easily understand due to the atrial contraction. So as you can see that there are the different waves. So this is initial waves. This is A, C, V, X and Y. So these are the different waves. Why this A wave is occurs? Due to atrial contraction. And just only before we discussed, whenever this atrial contraction will be happen, initially this valve will be open up, but once the contraction will be closed or contraction will be over, this valve is going to be closed. That will create the S1 sound. And whenever the atria is going into the systole or into the contraction, what about the pressure into the atria? Pressure is going to be increased. That makes the A wave into JVP. Right, Bada? Very good. Right? So atrial contraction with JVP is correspond to the atrial contraction just before the first heart sound. This is your A wave. Very good. C wave. This is due to tricuspid bulging. Then the X wave. This is due to the ventricular filling or atrial repolarization. V wave, the blood is coming from the venous area, or this is called that venous filling. So when vein drains the all blood into the right atria, again pressure of right atria is going to be increased. So that again lead to the positive wave, that is the high pressure wave called as V wave. And now this atria blood is going inside of the ventricle due to the pressure. So this lead to again decreased pressure into the right atria, hence it will making the Y wave, right? Y wave. So these are the normal waves of the JVP. There are some abnormal waves which you have to remember for your exam point of view. So absent A wave, this is seen in atrial fibrillation. Then prominent V wave, C and V wave merging, this is into tricuspid regurgitation. Then prominent X descent and Y descent, this is in constructive pericarditis. And prominent X descent or absent Y descent, this is in cardiac tamponade. Then V wave is more than the A wave, that is an ASD, atrial septal defect, and the Canon A wave, that is your third degree heart block, or you can call it as atrioventricular dissociation. So this is also known as atrioventricular dissociation. Atrioventricular dissociation. So it will show you the Canon A waves, right, beta? Talking about the next question, that which hypothalamic nucleus is primarily involved in regulating the thrust and the water balance? So now the questions from the hypothalamus area, very most important part, which is might be going to be asked in your exam. So this hypothalamic area you must remember at any cost, guys. So is this hypothalamic nucleus primarily involved in regulating the thrust and the water balance? Please answer me. So first of all, tell me different hypothalamus area which we have been discussed during the classes. So those are these ones. Number one, the suprachiasmatic nucleus. This is for the circadian rhythm. This is also called as biological clock. This is also called as biological clock. Which release which hormone? Yes, beta. You know, for the sleeping hormone. Yes, melatonin. Very good. Then the lateral nucleus, this is for the hunger center. And this hunger center, whenever you are hungry, there is releasing of the ghrelin, which increase the appetite. And then whenever there is releasing of the leptin, that appetite is decreased. Then the ventromedial nucleus for the satiety center. Lateral preoptic nucleus, that is for the thirst center. Supraoptic nucleus for ADH. Paraventricular nucleus, that is your oxytocin. Then nucleus accumbens, that is for the addiction pleasure. Anterior hypothalamus for cooling of your body, and posterior hypothalamus for warming your body, right, beta? So as you can see that different hypothalamus area are there. So you have to remember. So here it is asking about the thrust and the water balance. So suprachiasmatic nucleus, this is for the circadian rhythm. Then the ventromedial and paraventricular nucleus, you can see that this is the paraventricular nucleus, this is for the oxytocin, and ventromedial, this is for the satiety center. So these three are wrong answer. What remain? That is lamina terminalis. So beta, if in the option for the thrust, if it is given the lateral preoptic nucleus, then it is thrust center, and if it is not given in the option, then the right answer is lamina terminalis, right? Lamina terminalis. So lamina terminalis, this is regulation for the thrust and the water balance, right, beta? Now the next question, question number 22, that which of the following is not a physiological effect of angiotensin 2 in the renin angiotensin aldosterone system, that is RAS? Yes, beta, RAS. So when the RAS is going to be activate, when there is less blood will reach up to the glomerulus. So I told you this was your Bowman capsule, afferent arteriole, glomerulus, efferent arteriole. Here it is the cell is present called as JG cell, juxtaglomerular cell, right? It will release which hormone? Renin. When there is less blood supply into the glomerulus, right, beta? So what this RAS mechanism will do? So initially, you know that this kidney will release the renin. This will convert this angiotensinogen into angiotensin 1. This one will go into the lungs, and from the lungs there is angiotensin converting enzyme. This will convert it into the 2, and this will start releasing of the aldosterone. That will lead to increase the sodium and water reabsorption from the kidney, so that volume is going to be increased. Number 2, it will do the vasoconstriction, and number 3, it will do increase thrust. So basically in your body volume is going to be increased. So RAS basically release or activates whenever there is a hypotension or there is a dehydration in the body, then it lead to increase the RAS. Then this RAS will increase your blood volume, right? So now please tell me, it is not a physiological condition of the RAS. Vasoconstriction of arterioles, it is true. Increase in aldosterone secretion, it is true. And decrease in blood pressure, no beta, this is false. Basically it is increase the blood pressure and it is stimulation of the thrust. Yes, it is true. So right answer of this question is C, as the question is asking not true option, right? Talking about the next, the question number 23. The which channel present on arrow marked area of the renal tubules, right? Which channel is present on the arrow marked area of the renal tubules? So this area, basically, which channel is present? Which area this is? This is ascending loop of Henle. Yes, guys. This is ascending loop of Henle. So this is ascending loop of Henle. Which channel is present over here? Please tell me. This is your PCT, this is DCT, and this is collecting duct. राइट बेटा? यस, तो ये पिक्चर तो अपन भूल ही नहीं सकते हैं बेटा. क्लास के अंदर इस पिक्चर से तो अपन ने पूरी की पूरी किडनी को पढ़ दिया था, राइट? रिमेंबर बेटा, थ्रू दिस पिक्चर वी रिवाइज्ड और वी स्टडीड ऑल द कॉन्सेप्ट ऑफ द nephron or the renal part, and we can remember about the pharma, about the patho, about the physio, all of this nephron, right, via this picture. So as you know, yes, as you know, that channel which present over here, it is NKCC, that stands for sodium potassium 2 chloride symporter. So this is the another name, NKCC, sodium potassium chloride channel. NKCC stands for sodium potassium chloride channel. During the class, I told you that sodium potassium 2 chloride symporter, but here I just make little bit twist. This is NKCC. Now please tell me, NaCl, this is present into which area? No, Arvind, beta, this is only for the MCQ class, so I am not going to revise it over here again because many students are watching right now. I understand. But I hope, Arvind, that you can easily remember that photo or that picture that we have discussed, all the diuretics, everything via this single picture. Right, beta? I hope that you enjoyed during that class. और अब आप लोगों को जब ये फिजियो बेटा समझ में आ गई, when you understand all the part of the physio of human body, I hope that now medicine, patho, pharma, everything is very easy to understand or easy to remember. I hope that now you can apply better knowledge via this physio. Yes. So NaCl, this is present into the DCT. ENaC, where the ENaC is present? Please answer. ENaC. Where the ENaC is present? ENaC is present into the late DCT or in collecting duct. And which cell? P cell, principal cell, right, beta? P cell. SGLT2, this is in PCT, that is a type of secondary active via secondary active transport glucose reabsorbed back. Yes, Parminder, very good guys. Bilkul. So right answer of this question is NKCC. Okay, beta? Okay, very good. Let's discuss the next question. Which of the following is characteristic feature of SGLT1? Yes. Which of the following is a characteristic feature of SGLT1? Yes, guys. So question number 24, option number A, it's inhibited by thiazide diuretics. B, it is mainly found in the small intestine and facilitates glucose absorption. C, it is responsible for glucose reabsorption in the kidney tubules. D, it is primarily involved in the sodium reabsorption in the distal nephron. Yes. Bread and butter question. Yes, guys. Very good. Very good. वेरी गुड गाइस, वेरी गुड, वंडरफुल. आप लोगों को सैल्यूट गाइस, ऑल वंडरफुल डॉक्टर्स. अब ये क्वेश्चंस तो आई होप दैट आप अपने जीवन में कभी गलत नहीं करेंगे, जो कभी आपको समझ में नहीं आया था बेटा एसजीएलटी, ग्लूट, ये सब क्या होते हैं. नाउ वंडरफुल गाइस, वंडरफुल. आई होप दैट you are having little bit more confidence now that yes, you know this human body very well, right beta? Very good, wonderful. See, एग्जामिनर कैसे भी किसी भी लैंग्वेज में क्वेश्चन बना के दे दे, आप लोगों ने ऐसा पढ़ा हुआ है बेटा, you are 100% going to mark the correct options. Wonderful. So right answer of this question is option number B. That is, it is mainly found in the small intestine and it facilitates glucose absorption. That is why in the diarrhea, when there is a disbalance of the electrolytes, we require sodium inside of the body. So sodium is not going to be alone inside of the body in absence of the glucose. That is why this channel, which is required sodium and glucose both for opening, that is why in the ORS, we mix in the equal quantity the sodium and equal quantity of the glucose, so that this channel can easily open up and sodium and glucose can get entry inside of the plasma. Right, beta? Yes. Yes, Arvind. These are the emotions. Yes. Thank you. No, Anuj, beta, this is all because of you as well, guys. You basically listen me during the classes with very patiently. I understand very well. I know it. एंड आप लोगों ने जितना एफर्ट इन लास्ट कपल ऑफ मंथ्स में लगाया बेटा, रियली दिस इज ट्रेमेंडस, दिस इज वेरी वेरी रेस्पेक्टफुल. एंड आई होप दैट भगवान आपको इतनी शक्ति और बस कुछ दिन और बढ़ा के दे. ऑन 6th of July you should pass, or you are going to be pass, and you are coming with your flying colors. I hope and I wish to the God beta. Right? Talking about the last question of today's session, that which ECG finding indicates a delay or block in the conduction through the AV node? Yes. Yes, guys. तो बेटा आई होप कि अब तो आपको फिजियो से कभी भी डर नहीं लगेगा और नहीं लगता होगा. Thank you, Sachin, for such a wonderful words, guys. यस. देखो बेटा, कभी भी आपको ऑलवेज थिंक दैट वेन एवर यू नो द थिंग्स, when you know the things, even the difficult part can be easy for you. But if you don't know the things at all, the easiest part can be very difficult for you. तो आपको बस हमेशा अपने आप पे बिलीव रखना है, अपने आप से बात करनी है और अपने आप को बोलना है, यस यू कैन डू इट एंड यू आर गोइंग टू डू इट दिस टाइम. No one can stop you. You are the champion and you will be the champion on the 6th of the July. So, बस अपने आप को मोटिवेट करते रहो, अपने आप से बात करते रहो, आप 100% पास हो बेटा. 100% आपको पास होने से कोई नहीं रोक सकता है. I guarantee you बेटा, because I am having faith in yourself. But if you are not having faith, I am having faith that you can pass this exam. without anything. Right, beta? Yes. So please answer for question number 25th, that which ECG findings indicates a delay or block in the conduction through the AV node. So this is tells you that PR interval. So this is your ECG PQRST, and we know this is due to atrial depolarization, QRS due to ventricular depolarization, and in this atrial repolarization is also mixed, and T wave is due to ventricular repolarization. I told you that in the heart this requires electricity. This electricity actually generates from the SA node, then it travels and reach up to the AV node. Then this AV node holds this current for a while, due to that it will allow the proper ventricular filling, or it will give the time to the ventricular filling, and it will set the pace, and later on then it will start coming down like this. So basically this AV delay, this happens from this part to this part, and this is the PR interval or PR segment, right, beta? So basically, whenever there is a AV conduction or block in the conduction, what could be happen at the AV level? This PR interval will be prolonged. PR interval will be prolonged, right? PR interval will be prolonged. Tell me when you will find the decreased PR interval or shortened PR interval. That is your WPW syndrome. So how the ECG will be looks like? This is like this, something looks like, and this is your the wave which you can see over here. This is called as delta wave. This is called as delta wave. So WPW syndrome, what is happening in the WPW syndrome? The current is bypassing via this AV. So current is directly coming via the extranodal pathway, that is your WPW syndrome. So this PR interval is going to be shortened, but if there is AV delay is prolonged, what could be happen, beta? This prolongation you can identify into the PR interval, right? So this is easily the question can be stating that which ECG finding indicates a delay or block in the conduction through the AV node. So this will increase the PR prolongation, right, beta? PR prolongation. Okay. So here you can see that this is called as first degree heart block, and here you can easily identify that this is the prolongation of the PR in each cycle. Each cardiac cycle, it is showing the PR prolongation, right? So this is your first degree heart block, right? Three type of heart block we have been discussed during the classes: first degree, second degree, third degree. In second degree, again we discuss about Mobis type 1 and Mobis type 2. This third degree we also called as complete heart block, and block means this is not about the blood circulation. This is about the conduction or the current passing area. So if current cannot pass into certain area of the heart, that we call as block, or we can call as heart block, right, beta? So this is all about this 25 most important MCQ from the physiology part. Now I tried myself that to take all the high yield topics that can be that can be asked in the upcoming FMG exam, but beta, these all are just on my just best effort. As you know that this exam is uncertain, so you must study your complete workbook, you must revise it and a couple of times as well now onwards, because it will not take too much time to revise those important area from your workbooks. So beta, go with that part as well. And few things I just would like to tell you, that you are stronger than you think. Always remember that you are stronger than you think. जितना आप सोचते हो ना बेटा, आपकी ताकत उससे ज्यादा है. आपको पता ही नहीं है कि आप में कितनी ताकत है. आप इतने ताकतवर हो, आप इतने ताकतवर हो कि अगर आप चाहो तो आप क्या नहीं कर सकते. आप सब कुछ कर सकते हो बेटा. जस्ट बिलीव इन योरसेल्फ, जस्ट मेक yourself positive and go in this upcoming FMG exam with full of positive energy और फोड़ दो बेटा इस एग्जाम को जाके और कह दो लोगों से कि yes, I am the stronger, I am the stronger, and I am the stronger, and I am the doctor. Right, beta? So just believe in yourself. Come with the flying colors on the 6th of the July. You are the champions. Salute you from the entire MIST family, beta. Just stay blessed. We are blessing to all of you guys that God can give you all the strength to pass this exam, beta. So this is all from the 25 most important physiology MCQs. This is all from my side. Best wishes for the 6th of July FMG exam. Thank you very much, guys. Thank you very much. Bye-bye. Jai Hind.